Hi, my name is Dr. El Ghazawi. I'm an orthopedic sports medicine surgeon here in New York City, and we're going to talk about common questions about knee osteoarthritis. Question one, can knee osteoarthritis be reversed? Short answer is no. There are some things coming down the pike that do have some exciting potential behind them, but right now there's not enough data or research behind it to really tell you that there's a way that we can reverse or prevent the progression of arthritis. Question two, what are the best injections or medications for knee osteoarthritis? For me, I think the answer always comes down to starting conservatively and then slowly ramping up the aggressiveness of what we're doing. So that to me means you start with an anti-inflammatory. There's a whole class of medications that tend to do really well with knee arthritis. If that doesn't work, there's a bunch of different kinds of injections that you might read about. Cortisone used to be super popular, not so much anymore because we've learned that it can actually make the cartilage wear worse or weaken tissues. We use those a little bit more sparingly. There's another injection called hyaluronic acid or HA injections. And those are basically lubricating injections. It's the same substance or molecule that your knee normally produces. We're just kind of giving you more of it, kind of like an oil change. That can help with inflammation and pain management. Then there are the other injections, the biologic type injections that we're doing. There's really good evidence and research for an injection called platelet-rich plasma or PRP. Where we draw your blood, we spin it down, and then we inject the good stuff back in. No one can tell you for sure, with all honesty, how it works, and that's the truth of it. We have some ideas. The main idea is that we think it changes the cascade of events that's happening when cartilage breaks down and change the environment in your knee that can help with your pain and inflammation. Other injections that are even less studied right now are the stem cell type injections, where we can get stem cell from your iliac crest or bone marrow, or we can get stem cells from your abdominal fat. Again, those just need more studies to really know who the right person is, what degree of arthritis, and what the actual outcome will be. Okay, so the next question that I hear a lot is, can my knee pain lead to back pain? Yeah, unfortunately, yes. Knee pain can lead to back pain. I think that if your knee kinematics and your gait is altered because you're consciously or not trying to avoid pain, that puts stress on other joints, whether it's your hip, your other knee, or your back. And so that's where starting off conservatively with physical therapy, working on your knee mechanics, your motion, just your normal gait can actually help with other issues around your body, including back pain. Okay, so last question that I tend to get quite a bit is, how do I know when it's time to get a knee replacement because of my knee pain? For me, I think that people make that decision. What I tell all my patients is that you'll know when that pain has reached a point where it's interfering with your life enough, you can't do your daily activities, and it's a daily reminder. At that point, when you failed all conservative management, including therapy, medicines, injections, and you have arthritis on X-ray and MRI, a knee replacement is a really good option to get rid of your knee pain and get you back to a fully functioning life. So knee pain is one of the most common things I see every day in the office. The good news is that there's a lot of options out there. No one fits in a cookie cutter, and we decide based on your physical exam and your X-rays and your MRIs and basically your activity level, what is the best option for you. But the good news is that there is a whole menu of options out there that can get you back to a pain-free lifestyle. If you found this video helpful and you like it, make sure to like and subscribe. If you're in the New York area and you'd like a consultation, feel free to make an appointment at New York Orthopedics and be happy to see you.